My name is Augustine Kehinde from Brandman University. Today I'm going to be talking about my integrative therapy video. This is my signature assignment. Segment number 1. My case study today is about one of my patients. Her name is Katie. Katie is a 35-year-old African American female who is experiencing anxiety disorder. Patient reports having trouble falling asleep at night, and she's unable to get a good night's rest. She often feels restless or on edge, which she associates with not sleeping. She states she constantly worries about performance in upcoming examination, family, and her future. Her level of stress significantly amplified when she began to study or think about upcoming examination. She also states she wakes up at the middle of the night with headaches that last for a few hours. When talking to patients on our last appointment, she felt tense throughout the majority of the interview. She states this causes her to feel stiff, difficulty paying attention in her nursing program, and completing her homework. So I'm going to be using 3 therapies tonight that will be used are family therapy, interpersonal therapy, and cognitive therapy. Family therapy. This is a type of psychological counseling therapy that can help family members improve in their communication skills and resolve conflicts. Family therapy is also culturally benefiting for most Europeans and African American or African descent that believes in highly in family involvement. The cultural influences of the family can uncover future problems or issues to be resolved. Interpersonal therapy. Interpersonal therapy is based on issues in relationship with other people. It provides active, non-judgmental treatment in order to help people in therapy successful, handle challenges, and improve mental health. The cultural benefit for interpersonal therapy is the ability to connect with family members, such as Asian families, where their individuals can speak about how they have influenced on others. Cognitive therapy. This is also a relative short-time focused psychotherapy for a wide range of psychological problems, including depression, anxiety, and anger. The focus of this therapy is on how you can think, behave, and communicate. Today, rather than on your early childhood experiences, the cultural benefit for cognitive therapy, it helps the individual think about themselves and the way they express themselves. The benefit helps the individual process different circumstances with multiple lens, which is used in European cultures. So now I'm going to go into my segment number 2. I'm going to be inviting my patient in, and I'm going to be asking for her consent before recording this video. I'm going to start with my family therapy, which can be useful in family situations that causes stress, grief, anger, or conflict. It can help you and your family members understand one another better and learn coping skills to bring you closer together. So today, my patient's pseudonym is Katie, and I'm going to be asking for her consent. Katie, do you have my consent in recording this video?
Yes, you have my consent.
Thank you. How are you feeling today?
I'm okay.
I can see that you're still anxious. Tell me more on why you feel this way.
I have a lot of things in my mind. I don't want to be here. I have things to do. I'm too busy. I can't be taking breaks. I have a lot of things to study and review.
What kind of things do you have in your mind? And what are you worried about?
I have an important exam to take. It takes my it determines my future for me and my kids. I have lots of worries. I can't sleep and eat. I get diarrhea every day because I am so worried for the worst.
Okay. I see that you're worried about your future for you and your kids. What some other external stressors that you are facing, Katie?
I have to pay my bills. I have to make sure my kids have something to eat and wear. I have a lot of responsibilities to handle, and I feel stressed every day about them all.
Hmm, interesting. Wow. So I can see that your family is important to you, Katie. I want you to apply family therapy into distressing yourself. I want you to speak to your family about what bothers you and how you feel about this pressure. Your family will be a coping system for you throughout your studying for this examination when you use this therapy. Okay? So now I'm going to be going to my segment number 3, which is interpersonal therapy. Like I said earlier, interpersonal therapy is a form of psychotherapy in which it focuses on a patient's relationships with peers and family members and the way they see themselves. Interpersonal therapy is based on exploring issues in relationship with others. Okay? So, Katie, this exam that you're about to take, have you done something like this before?
I have taken sample exams like the actual exam. I have tried and found resources to help me with studying for this exam, but I'm just so nervous that they are not the right resources and I'll be learning the wrong information.
Hmm. Okay. However, do you think the stress is coming from external forces mainly or internal forces?
I think both, but internally I am scared. I am scared to fail. I don't want to miss my chance to change my kids' lives and mine. I have thought about all the worst possible scenarios that can happen. I
Wow.
have so much negative thoughts in my head.
Okay. Katie, tell me, have you ever thought of harming yourself?
I don't think so. I am just tired. I'm just tired of studying and having all the pressure of my family on me.
Okay. Tell me, what does your role entails as a mother?
I'm supposed to be providing for my kids. I'm supposed to be their caregiver, and this exam can help me be a better caregiver for them with providing me with the right resources to help my family grow.
Well, you can use interpersonal therapy by finding out ways that you, as a person, affect the life of others. You can also speak to your loved ones and ask them what they believe you have done for them and what you can do better. Okay?
Okay.
So now we're going to go into segment number 4, which is the cognitive therapy. Cognitive therapy helps the patient learn effective self-help skills that are used in homework assignments that help you change your way you think, feel, and behave now. Cognitive behavioral therapy is also action oriented. It is more practical, rational, and it helps the patient gain independence and effectiveness in dealing with real life issues. Okay, Katie, what are some of the emotions or symptoms that you experience when you think about this examination?
I can't stop moving. I start to pace my house. I start becoming sweaty. My heart starts beating like it's about to fall out of my chest. I sometimes cry when I think about this exam. It stops me from enjoying time with my kids.
What are some ways you have coped with this type of stress in the past?
I sometimes take my kids out for fun activities and relax with a good movie. Sometimes that helps.
What are some positive things that you think can happen with this examination?
So I will be getting my license to start my career. I'll be working in a highly respected career. I will be doing something that I love to do.
Well, I have an assignment for you, Katie. I want you to have a great, I want you to create a journal for me. In the journal, I want to write one negative and two positive things every day for a week. Then progress into writing one positive things every day. Combined with this journal assignment, I want you to use only words that affirms, such as I can do it, I believe in my abilities, I can pass this coming examination. Okay? Can you do that for me?
I can.
Very good. So this ends my section with Katie. Today we have used 3 different modalities in addressing our anxiety issues. The first one we used was interpersonal therapy. We used family therapy, and the last was cognitive therapy. We hope to continue this session some other time with my patient. Thank you for watching.